Hey, welcome back, everybody. Dr. Dan Lister of the Surgical Clinic of Central Arkansas joins us now, made possible by St. Vincent. Always glad to have you on the show. Good to see you, man.
Good to be here this morning.
Yeah, we're talking acid reflux surgery, incisionless, though.
Yes.
I'm guessing you're going down through the mouth.
Through the mouth,
yeah,
to rebuild the valve at the end of the esophagus,
yeah,
at the junction of the esophagus and stomach, so that people don't reflux back up and have all that heartburn and problems associated with it.
That's amazing. I know a lot of people are affected by that, and we've already got callers on the line, so maybe during the time that you're answering about them, we can talk about kind of how it's done and who might be a good candidate for this. But let's go first to Lisa from Bauxite. She is up on the phone, and Lisa, good morning to you.
Good morning.
Yeah, go ahead.
I've had the pipes gone down my throat about 4 different times, and I was just wondering if the surgery might do any good.
Well, it definitely can help. If you have reflux, the problem is the valve at the bottom of the esophagus leaks, and we can go in and rebuild that valve. We just need to make sure that that's your problem. If you've had problems like strictures and they've had to stretch that, or esophagitis or irritation from reflux, then the surgery can definitely help.
Yeah, but I guess there are sometimes, though, that there are other underlying problems, probably.
Oh, there are. There can be, people can have esophageal spasms or muscles that don't work right, and their symptoms will mimic reflux. So there's testing that we have to do preoperatively, and we do that in part of the workup to make sure that the person's a good candidate for the surgery.
Yeah. Does it get worse as we age?
It does. Everything stretches. You know, the muscles stretch, and the valve gets loose, and that's the beauty of this surgery, is we can rebuild that. And if it restretches 20 years down the line, we can rebuild it again, where surgeries that have came in the past were kind of a one-shot deal.
Very good. All right. Well, let's go ahead. Susan from Cabot, you are up next. Susan, go ahead.
I was just wondering what the downtime for the surgery would be, how long it takes, and how long it would be before you return to work.
Well, the surgery itself takes about 30 minutes, and most people are able to go back to work within 3 or 4 days. It's a one-night stay in the hospital.
Oh, really?
Yes, it's very quick recovery.
Wow, goodness. And eating normally and everything from that point.
Well, you're on a liquid diet for a couple of weeks because you got to let the swelling go down from the surgery. And on the video here, you can see the instrument goes down the esophagus, and we take the scope and look back at the junction, and then the device will grab the junction of the esophagus and the stomach, and we can wrap the upper part of the stomach around the esophagus, and that's how we rebuild the valve.
That is amazing. Yeah, it's really amazing
device.
stuff.
It's got a little corkscrew, comes in and grabs the junction, pulls the esophagus down, and then the device, the tissue mold, will pinch the stomach up against the esophagus, and then we are able to put little sutures in from the device that are like the little plastic things they put pairs of socks together.
Yeah, exactly.
And we put about 20 of those in. It takes about 30 to 40 minutes, and excellent surgery. And people wake up in the recovery room and their reflux is gone.
That is awesome. Hey, we have got time for one more call. Delana from Brinkley, you are up this morning for Dr. Lister. Go ahead.
Time for one more call.
And turn your TV down too.
Dr. Lister, go ahead.
Yes. Is there like an age limit on this? You know, like too young or too old for this surgery?
Well, I have done people from the age of 16 to about 85. So it's the younger they are, they have to be big enough for the instrument to go down the esophagus without tearing. Old, as long as on the upper end of the age group, as long as you're healthy for surgery, you're good to go.
All right. Hey, I think it's a tremendous invention and a tremendous technique. If you'd like more information about it, you can always contact Dr. Lister at the folks at his clinic. He's at the Surgical Clinic of Central Arkansas, and we want to thank St. Vincent for making him available to come by and tell us all about that. That's good information, man.